Hi, this is Dr. Roy Kim. We're here to talk about prominent ears in adults. If you have prominent ears, there are a bunch of different medical diagnoses that you may have. So what really I'm talking about today are ears that actually stick out, but you're not missing any material, all the cartilage is there, and you're an adult, not a child. So the medical term is called prominent ears, and the surgical term to correct it is called otoplasty, which basically means to reshape the ear. As a child, I can actually place sutures behind the ear, bend it, mold it, and do surgery where there's not as much pain. As an adult, I may have to make incisions or score or do something to your ear cartilage to weaken it on this side so that it can actually flex back. And scoring it typically hurts a little more, and I want to be very, very clear when I do the surgery that both sides match. So one of the keys, of course, is not making one ear look great. I have to make both ears look great, but also match in terms of how much they're pulled back and to achieve as much symmetry as possible. So about 5% of the population has prominent ears. So this, of course, fortunately does not affect your hearing, but it may affect your confidence. Just in case you've ignored it, or you just never felt that you wanted your ears to actually have surgery, but as an adult, you want to have them more in proportion to the rest of your face, there is an answer, which is, of course, surgical otoplasty. So as an adult, of course, we need to do a consultation. I probably need to see you in reality because I want to see actually how stiff or non-stiff your ear cartilage is. This determines whether I need to use more advanced techniques so that not only can I do the surgery properly and pin your ears back, I can do it with longevity. In other words, I feel confident that it will last a long period of time. On the actual day of surgery, of course, you'll receive numbing medicine, and hopefully we could do this in an office setting. If not, we'll be in the meeting in the operating room, and you'll have a little squirt of sleeping medication, deep sedation. In about 2 hours, I can complete this procedure. Sometimes in adults, I do have to score the front of the ear, in other words, the ear cartilage. This is underneath the skin, of course, but actually where the cartilage is. That way, I can actually bend it back, make sure it stays bent back, make sure it's symmetric on both sides, make sure aesthetically it looks appealing, so that you can have long-term results. And then, of course, I usually need to put sutures in behind your ear. Now, of course, I'm lifting up the skin and I'm putting the sutures in the cartilage, and that's usually how it's done. Of course, ear surgery is not just about your appearance. All of my patients feel much more confident after having this done. They can actually alter their hairstyle so that they can show their ears a lot more too all the time. In the past, patients would often have to sort of grow their hair long, or they would just try to hide it. After otoplasty or surgical ear correction, they can wear ponytails, they can get a short haircut, they can show their ears, and they're not conscious about it at all. In terms of the incision, this is one of the great things about ear surgery. The incisions are behind the ear. So even with a short haircut or wearing a ponytail, the incision is basically very difficult to see. Someone sort of has to be behind you, and you have to curl your ear out, and they sort of have to stare at literally the rear of your ear to maybe see something. And to be honest, patients have never really told me that other people have noticed, because that scar is really hard to see in general. In terms of recovery, most patients do have to wear a headband to make sure that the ears stay in very good position over a couple weeks. And the pain control is really not a huge issue with this type of surgery. You can return to work pretty quickly if you have the type of job where you're not really being seen that much. In other words, you don't have to go in public, maybe you work from home, maybe you can work from home a little so that people aren't necessarily seeing you on video call. That's sort of the perfect time to get the surgery. So I hope that you understand now that if you're an adult, there is hope. Specifically, the ear surgery, the otoplasty that you may need, is a shorter procedure. It's done on an outpatient basis. Heck, you may not even need general anesthesia depending on how flexible your ear cartilage is or not. And the recovery is pretty fast. The pain control is not a huge issue. I do think that it's one of those things where if you have prominent ears and you're subconsciously or consciously always hiding them, well, this is your opportunity to gain the confidence and just live your life with any hairstyle you want, and also have your ears holistically be in proportion to the rest of your face. So of course, on this YouTube channel, we have a bunch of other videos. Please watch over here. If you have any topics you want me to talk about or discuss, please fire away, let me know. And as always, thanks so much for watching. Have a great day.